Good evening. Thanks for joining us at one of our Brave Roundtables. I'm Dr. Regina Fairmonti. I'm a board certified plastic surgeon with over 15 years experience, and really one of my passions is breast reconstruction. Started out doing a lot of microsurgery, which is autologous abdominal based reconstruction, and now I'm doing mostly implant and expander based. Tonight, I am honored to be joined by three very diverse guests that each have, a very interesting story to share. We have Miss Ashley, Miss Katrina, and Miss Lauren. Let's start with introducing ourselves. Miss Ashley, let's start with you.
Hi, everyone. I'm Ashley Libby Diaz in Durango, Colorado. I'm a young adult breast cancer survivor. I was diagnosed at the age of 36 and am approaching, I believe it's 8 years out now, which is exciting, maybe 9 years out. I can't quite do math at this point in the day. And also a member of the Brave Board of Directors. So excited to be here with all of you tonight and hear everyone's stories.
How about you, Katrina?
Hi there, my name is Katrina Johnson. I'm a 3-time triple negative BRCA1 positive breast cancer survivor and thriver. I also I should have said first, I'm a mom to Kaylin and Gavin, because I think is more important. And I'm a daughter to Ed and Ruby Marvin. And I also am a patient advocate, and I lead a patient advocacy for breast cancer at Pfizer.
And Lauren.
Hello, I'm Lauren Marie, and I am a breast cancer survivor of a little over a year. And I had early stage breast cancer and was treated with bilateral mastectomy and a DIEP reconstruction.
Mm-hmm. So we have a really diverse group. Kind of going off schedule here. I think it would be interesting to hear how you each got to your diagnosis, how you found out you had this, what kind of screening were you undergoing before this? Did it work for you? And then what were the next steps? Who wants to start out? Miss Ashley, you want to start?
Sure, happy to. So I have a bit of an interesting journey. I was laying in bed one morning about 1.5 years, 2 years before my diagnosis, and one of our cats decided to walk across me. He's a bit of a heavy guy. And I felt this searing pain in my right lower breast. And I was a physical therapist at one point in my life and knew that that was not a normal pain. I went to, at the time, so I was about 34 then, went to my primary care physician, who offered me kindly a chest x-ray, which I promptly declined, knowing full well it wasn't my rib. But because of the pain and the nature of it, I decided to continue to monitor that area and see if the pain persisted, and it did. So I turned 36, thankfully, and I was going in for my annual exam and decided the night before maybe I should, in fact, see if the pain was still there. And not only was the pain there this time, but I felt a lump. So that essentially started my workup. I had a mammo, which was negative. I had dense breast tissue, fibrocystic tissue, and so had an ultrasound at the same time I had the mammo, which in fact showed a number of cysts, but also this lone tumor growing in my breast. So had a biopsy. Turned out I had very strongly ER positive, PR positive breast cancer. I was diagnosed with invasive ductal carcinoma, but thankfully an early stage. And then started the workup with my breast surgeon. My BRCA1 and 2 are negative. My genetic testing has all come back negative, but I have a deep, sadly, history of cancer in my family, and cancers that are known to run in packs. And so I continue to get tested regularly for more genetic elements of my cancer since I was
Ashley, was that
36.
your very first mammogram then? That was your very first mammogram? Mm-hmm.
It was my first mammogram, and it was indeed negative. So yeah, so that brought me here, and happy to go into my treatment, but happy to have others talk about their diagnosis and history before we jump into that.
How about you, Katrina?
Sure. Yeah. I hear Ashley's story and there are similarities. I also was an early stage diagnosis at 28, which I just hit my 20-year cancerversary this year. But in the last 20 years, I've had 2 additional diagnoses and then 2 melanomas on my lower left leg. Mine was, I found a lump. And when I made an appointment urgently with my gynecologist, I was told, you're too young to have breast cancer, but we will go ahead and do a mammogram and a sonogram. So a really scary component is that they actually marked the spot and sent me down for imaging. And even with that spot marked, it did not show up on mammogram or sonogram. So I was told, you're good, just go home. You have a fluid-filled cyst in your left dense breast. And I went home and 3 months later advocated for myself and thought, why is this lump still here? So I made another appointment. That time they did a biopsy, and sure enough, it was a stage 1 invasive ductal carcinoma. Unlike Ashley, I am a BRCA1 carrier and have a deep cancer history. And we actually found out that my dad is also BRCA1. My mom, who has had breast cancer, was not BRCA at all, 1 or 2. So we've kind of traced it up through my paternal family line. So I'll pass it to Lauren.
Wow. So I had just a regular screening mammo, and as I aged 40 plus, as I continued to get more mammos, my breasts became more dense, and they would always ask for the oblique views, so I'd just pay up front for out of pocket for the extra views. And then this last time, they just found that I had something going on. So they sent me back for diagnostics, and they found something. It was very small and very deep. And the radiologist wanted to watch it for 6 months. And I was a little uncomfortable with that. I really didn't think I had cancer, but I was like, you know what, let's just knock it out. I'd rather figure it out, because the mammograms were really, really hurting. And I thought that was odd to how intolerant I was becoming of these mammograms. And so I hired an oncology surgeon and asked her opinion. She couldn't feel it. It was deep. It was small. She said, look, we have some imaging options, but at the end of the day, let's just take another look at it in 6 months. And we did. And it hadn't changed, and a different radiologist read it and said, yes, you definitely need a biopsy, and I want you to biopsy it tomorrow. And I was like, okay. So it was a really early stage 1A cancer, a papillary. And I tested negative with all my genetic testing. And so I was just fortunate enough to be able to, because of the paternal family history of breast cancer, I was able to get a bilateral mastectomy and reconstruction. And so I feel like I did advocate for myself. I'm a provider. I'm a physician assistant. I know that, things can be misleading, false positives, false negatives. And even though I didn't feel it, I just stayed up with that plan to follow up and due diligence. I just didn't want to mess around with the cancer. And I'm just really grateful. I'm grateful for mammo screenings, despite them not being perfect. There's no way I would have ever felt it was just too deep and too small.